The Department of Health, DOH, met with Metro Manila hospital administrators on Monday to ensure that all of them complied with the mandatory 30% allocation of beds for COVID-19 cases, especially as the capital was seeing yet again a surge in new infections. Health Undersecretary Maria Rosario Vergeire said that while there were reports that some hospitals were nearing or had already reached capacity, this did not necessarily mean that they were overwhelmed, as was the case when the local outbreak started in March. When a hospital declares it is a full capacity, we must be very cautious in interpreting this. All hospitals were mandated to allot 30% of their bed capacity for COVID-19, but not all hospitals complied with this, Vergeire told reporters. For example, a 400-bed hospital may have allocated 50 beds for COVID-19 or 12.5% of its capacity. So when they declare they are at full capacity, it's only for the bed they have allocated for COVID-19 and not the entire hospital. There's still room for every hospital to expand. That is what we are doing in our government hospitals, she said. Under DOH Administrative Order Number 2020-016, released on May 14, at least 30% of all public and private hospital beds should be dedicated to COVID-19 cases to meet the government's minimum health capacity. Vergeire said many hospitals had not complied with the requirements, so they were instructed during Monday's meeting to follow the order and to be prepared to implement additional 20% surge capacity if and when needed. Over the weekend, Chinese General Hospital and Medical Center said its COVID-19 ward was running at full capacity as the number of severe cases it was attending to was more than those seen last March. This has a palpable impact on our resident and nursing manpower with deleterious effects on their physical and mental health and residency training, Dr. Samuel Ang, the hospital's medical director, said in a statement. The hospital, however, did not specify how many of its COVID-19 beds were occupied, but DOH data show as of Thursday, all of Chinese General's 23 isolation beds and 7 intensive care beds were occupied. As of this writing, no other hospital in Metro Manila has issued a similar announcement. In a letter to Health Secretary Francisco Duque III on Monday, Ang clarified that what he meant by full capacity was Chinese General's 30% COVID-19 bed allocation. What was not mentioned in my memo was the fact that we made arrangement with the Philippine General Hospital and San Lazaro and other quarantines to accept our patients. This support from the government has provided tremendous effect on the morale of our hospital staff, Ang said. All COVID-19 beds are occupied. Besides Chinese General, 10 other hospitals in Metro Manila have reported that all of their COVID-19 beds were occupied. These were Veterans Memorial Medical Center, University of Santo Tomas Hospital, University of Perpetual Health Hospital, Tondo Medical Center, Siemens Hospital, Philippine Children's Medical Hospital, Metro North Medical Center and Hospital, Las Piñas Doctor Hospital, the Los Santos Medical Center, and Capitol Medical Center. 3 other hospitals in the capital have reported nearing COVID-19 capacity. Lung Center of the Philippines, 97%, East Avenue Medical Center, 89%, and UERM Memorial Medical Center, 83%. Citing reports from government-run hospitals in Metro Manila, the DOH received on Sunday night, Vergeire said that though there is still no shortage, these hospitals are already at the moderate risks level in the use of critical care resources. DOH data showed that in Metro Manila, 68% of the isolation beds, 17% of the ward beds, and 51% of all intensive care beds are occupied. Nearly 30% of all mechanical ventilators are in use. We still have enough room should our cases continue to rise, Vergeire said. As of Sunday, the national bed occupancy is 40.7% for intensive care beds, 40.6% for isolation beds, and 45.3% for ward beds. Vergeire said that while the number of COVID-19 cases in the country continues to rise, nearly all of them are patients exhibiting mild symptoms or are asymptomatic. On Monday, Vergeire reported that the DOH is closely monitoring at least 4 cities in Metro Manila after they reported increasing infections over the last 2 weeks. Vergeire identified the 4 cities in Marikina, Muntinlupa, Quezon City, and Makati, which recorded a case growth rate of at least 30% in the last 14 days. Marikina topped the list with 51 cases for a case growth rate of 43.47%. Muntinlupa's 30 cases represented a 35.16% case growth, and Quezon City's 406 cases, 34.5%, and Makati's 135 new cases, 30.18%. Vergeire also said 314 barangays in Metro Manila and 64 barangays in Cebu City had reported clustering of infections or more than 2 cases in a specific area. In Metro Manila, she said the DOH was closely watching 3 closed settings with case clusters. One of the 3 Metro Rail Transit 3, where at least 172 workers have caught the new coronavirus that causes COVID-19. We cannot overemphasize the fact that everyone should follow our minimum health standards. When we started easing our quarantine measures, a specific condition was that the minimum health standards should be implemented, followed, and practiced by every citizen, Vergeire said. Among those standards are wearing protective masks, observing cough etiquette, frequent hand washing, physical distancing, avoiding mass gatherings, working from home, and isolating people who have come in contact with confirmed COVID-19 cases. Sharp spikes in new infections have been reported since the government eased quarantine restrictions in Metro Manila on June 1 to reopen the economy. Malacanang, however, said on Monday it might reimpose stringent restrictions if the case doubling rate sped up again and hospitals got overwhelmed. Presidential spokesperson Harry Roque told reporters that the further easing of restrictions or reimposing tougher measures would depend on the infection data by July 15. If critical care capacity goes down, which it has not, and we are still at moderate risk, as I said earlier, and if the case doubling rate speeds up, there is a possibility of a stringent quarantine, said Roque. He, however, said that the government wanted to continue reopening the economy. Our economic manager said we cannot afford another complete lockdown, Roque said. On Monday, the DOH reported 2,099 additional infections, national caseload to 46,333. Of the additional cases, 1,258 were patients who tested positive for the new coronavirus in the last 3 days. Of these patients, 601 were from Metro Manila, while 280 were from Central Visayas. The remaining 841 cases were people who tested positive 4 days ago or earlier. Metro Manila also accounted for most of these cases, 397, followed by Central Visayas, which had 186. The DOH also reported the recovery of 243 more patients, bringing the total number of COVID-19 survivors to 12,185. The death toll, however, rose to 1,303 with the deaths of 6 more patients.